everyone. Welcome to the webinar. We're here to discuss the Health Security Innovation Challenge and the $200,000 prize associated with it. My name is Laura Murphy, and I'm here on behalf of Tech Connect, which is a division of Advanced Technology International. And I'm joined by Mike Stebbins, who is the Senior Vice President of Medical and Health Security Portfolio at Advanced Technology International. And he also heads up the two consortia that are standing up this challenge. So today we're going to walk through the ins and the outs, how to apply, the dates and things you need to know, kind of the nitty gritty. More importantly, you'll hear from Mike about why he's putting it up, what it is they want to see, and we can talk a little bit about scope and sort of tips around how to submit something successful into the challenge. So we will get started. So what is this? We're submitting, we have submitted a national call for disruptive solutions in biotech, AI, diagnostics, therapies, sensors, and protection technologies. We're aiming to enhance national preparedness, detection, and response to CBRN and health security threats, and there are $200,000 in non-dilutive prizes. You'll learn more about how all of this connects to national security. So obviously we are not a direct government agency or something, but you'll hear a bit from Mike about how that actually works with consortia and how our impact actually flows back to national defense and preparedness. So there are 6 focus areas. You can learn more about them on the website with some specific examples. I've listed them here on the screen. I know there are a number of questions always kind of about scope and what's in, what's out. Mike, let's talk a little bit about that. Feel free to ask those questions, of course, but if you fall into any of these categories, if this is the sort of thing you focus on, then you are very likely a good fit. Next-gen prevention, advanced treatment, smart diagnostics, threat detection, integrated protection response, and adaptive and autonomous systems. So who should apply? Really a pretty wide range. We're looking for strong solutions. So we're not leaving anyone out, so to speak. You could be a startup, you could be from a lab or university, you could be a small to medium enterprise. But we want to see people who are working at the intersections of these sort of spaces, who are kind of tackling the challenges that we've listed here. Most importantly, we're interested in that the solution is appropriate to fit the challenge. So if your work contributes to this, then we definitely want to hear from you. And I would say err on the side of assuming that you are in scope. Don't eliminate yourself because you think, oh, the one thing that I do doesn't feel exactly in this category. These are sort of buckets we've used to help frame what we're looking for, to help put guardrails on there, but know that it's not overly rigid. So what you can win, there's a total of $200,000 up for grabs. This is how the prizes are broken up, essentially into 2 tracks. If we go back and look at the solution areas, the first 3 you'll find in one track and the second 3 in the other. So this all fits into your normal application. You don't need to think about what track should I be on and how should I submit into one or the other. Submit your solution as you would, and just know that no matter what you are, you'll be vying for prize money based on that. And we're awarding from the 2 different consortia on different tracks. Each of them are putting up $100,000. So you could win $60,000 as the first place, $30,000 in second, or $10,000 in third place. So some key dates: we launched in February. We have our webinar today. Welcome, glad you're here. Our application deadline is April 16th, and we're going to notify finalists in mid-May. And then the pitch event will take place at a joint member meeting in July in Baltimore, July 23rd. That's where you'll go, and we'll make a final determination of the winners. So this is how it works. You're going to apply. The expert review panel, which represents consortia and others sort of at the table, who are technology experts and understand sort of the business case as well that the consortia are looking for, will evaluate all of the solutions. Every single one will get looked at. We will invite finalists to pitch, and that will be held, as I mentioned, on July 23rd at the consortia member meeting. And then at that pitch event, you will know if you won. We'll make a decision there for all 6 awards. The review criteria: so we're looking for your overall impact and value. How ready are you to deploy? How far from that? Certainly there may be a sweet spot, and Mike can speak a little bit more about what exactly is sort of an ideal technology readiness level, or how can you know if you really fit in there, or what things could you highlight in your application or your pitch that would help us understand your readiness. scalability, how can we grow what you're doing, financial viability, and pitch quality. Why should you apply? I've mentioned the prize money as well. It's non-dilutive, which is a pretty unique opportunity, but also there are other people in the room. So you get visibility with federal healthcare and industry leaders that will be there, as well as from the review panel that are also, represent some of those folks. Potential pathways to contracts and partnerships, that goes back to what the consortia offers, as well as what could happen in the room. But specifically, both consortia offer access to those two things. And of course, opportunity to pitch at a national event. So my part is quick. I want to close by reminding you to submit questions in the control panel as we go through. At the end, we're going to entertain those for as long as we can until we run out of time. And if you want to learn more, this is the website, healthsecurity.techconnect.org. And don't forget the deadline is April 16th. So with that, I'll turn it over to Mike just to kind of frame out for us, what are the two consortia? What do they do kind of at a high level? And then, tell us a little bit about what you're really looking for and why you're standing up the challenge.
Great. Thanks, Laura. If I could have you go back to one of the first slides, and I'm just going to go into a little bit more detail based on how you laid this out. So, we can stay there on the challenge focus areas. So I'm sure we have a handful of members of each of these two consortia, and I just want to take a moment to introduce you to the consortia and why they exist and what they do. I anticipate we have some folks on the line that may not have that situational awareness. So both of these consortia, the Medical Seaborne Defense Consortium, MCDC, and the Countering Weapons of Mass Destruction Consortium, or CWMD, were stood up back in 2016 and 2017, respectively. And they both have, as a federal government sponsor, so to speak, the Joint Program Executive Office for Chem, Bio, Rad, and Nuke Defense. So that's a joint program out of DoD that is really chartered to address an advanced development and prototyping level the medical and counter WMD technologies necessary to counter exposure to our warfighters from chemical, biological, rad, or nuke threats. And there's a couple words I used in there that are really important, and I'll talk about maybe their importance to this challenge. The work that's being done is advanced research and development, and it's prototyping, meaning we're looking at stuff that's in the fairly advanced technology readiness level, 6, 7, 8, maybe 9, that ultimately could be either prototyped in the field with our warfighters or do some test and evaluation before it gets prototyped and then ultimately produced at scale. But the research that happens through these consortia, and I'll talk about that process, often is a little bit to the left of advance, and that's where these challenges really allow government to understand what the state of the art is and the state of technology is out in the industrial innovation space. And so real briefly how these consortia work with the federal government, the JPEO and sister agencies like the Defense Threat Reduction Agency are looking at a portfolio of work that they need to accomplish annually to meet their missions, and in this case, to meet the mission of the warfighter. And so as they come up with these portfolios, in a lot of cases, it's important for them to be able to reach out broadly across industry so that they can get the best of breed and the best technology out there. And one of the ways to do that is through a consortium of providers. So in each of these two consortia, MCDC and CWMD, we probably have close to 750 or maybe 800 members that play in this technology space. And the government has reached out to those companies very quickly through ATI as the consortium manager for each of those efforts. And then they issue solicitations for advanced R&D that they need to accomplish. And to date, there has been nearly $8 billion that have flowed through MCDC out to project performers to execute advanced R&D projects, and a little over $1 billion that has flowed through the counter WMD consortia. So we're talking nearly $10 billion since 2016 that have flowed out into industry to address needs that the federal government has. So why are we doing this challenge? Well, the consortia have money that they want to be able to help the federal government understand what is out in the innovation space that may not be directly aligned with their specific solicitation or requirement needs. And so this is one area where we can not only give back to members by offering these prize challenges, but in a sense, it ends up being an unsolicited proposal that you have the opportunity to get out in front of not only other members in industry, if you're looking potentially to team or to partner, but also to the government. And so while we'll end up with 3 winners on one side and 3 winners on the other side, a good number of the information that we get in will go back to our government customers just so they have awareness of what's out there in the state of the art. And so let me talk a little bit about the high level focus areas for both the challenge as well as for the government customer. Now, I don't need you necessarily addressing specifically what the DoD might solicit through these consortia, but to think broadly about responding to chemical and biological threats, or radiological and nuclear threats as well. And just to broaden the aperture a little bit and maybe sweeten the pot is while these 2 consortia are aligned with the DoD and the JPEO, ATI also manages within our medical and health security portfolio, we manage another DoD-sponsored program that's looking at medical technology devices, combat casualty, military medicine, as well as several programs within HHS. Now, we all know there's some consternation going on in the government right now as they deal with the transition, but the need doesn't change. And so there's several areas within BARDA where we are looking at next generation vaccines, therapeutics, and med tech devices, as well as the entirety of the biopharmaceutical supply chain, from KSMs and APIs all the way to fill finish and out the door. So keep that in mind. But these 6 challenge areas really cover not only the areas within DoD, but more broadly within ATI's medical and health security portfolio. And we'll have the opportunity to get some of the more salient inputs out to government customers in both DoD and within HHS. So let's talk about these just real quickly. There's a lot of information on the website, but next gen prevention. So what we're talking about there is next generation on vaccines. So vaccines, vaccine platforms, use of mRNA-based countermeasures, antibody development, and other deployable biotechnologies. Fairly broad, but we're talking about advancing the game from where we are today to what's next. Advanced treatments in a similar vein, but now we're looking more formally at therapeutics. So small molecules, maybe nerve agent treatments. That's always an area that's of interest within the DoD in particular. Gene-based medical countermeasures, and certainly rapid response therapeutics. And we could be talking therapeutics that are pre-symptomatic as well. Moving down to smart diagnostics, certainly AI-driven medical decision tools that could identify chemical threats, biological threats, perhaps both, microphysiological systems, prediction tools, assay development, etc. Threat detection, again, is now we're talking by and large sensors. So whether it's wearable biosensors, sensor integration, sensors that might sit on autonomous vehicles so that we're sending out a vehicle into a threat space before we send out human assets. Agent identification technologies would all fit within threat detection. Integrated protection and response. We're now talking CBRN, so chem, bi, rad, nuke, resistant materials, self-detoxification, decontamination technologies, isolation, quarantine solutions, etc. And then the last, a little bit of a catch-all, adaptive and autonomous systems. Again, this has a little bit of overlap with some of the other areas, robotics, sensor fusion, any use of AI, powered situational awareness. So an example of where situational awareness is really important. Imagine, warfighters out in space where there might be a threat. So they're sending out an autonomous vehicle. It might have 3 or 4 different sensors. Those sensors need to be able to talk to each other. They need to be able to talk back to Command Central. Decisions have to be made all within a very short period of time, but all of those systems have to be working together. And then where do you tie in real-time monitoring on the person as well? So all of those fit within those focus areas. So broad focus areas, but meant to be broad. We do not, I ideally do not want to tie you into such a specific area and where you might not know where you want to apply. So if we can go down to the next slide, real quickly. What I liked about how Laura set this up is if you look across our consortia, probably 80 to 85% of the member companies or entities are small businesses. And that's important not only because there's legislation that favors the participation of small companies, but it's often the small companies that are really driving innovation. And so, but in some cases, small companies don't have the wherewithal to prime a large multi-million or tens of millions of dollar award. And so they are also looking for partnering opportunities. And so I think this slide really sums that up. If you are in these spaces or think you're in these spaces, then you're absolutely eligible to apply. And we tie it back to what's the overall objective. There's a couple objectives from my standpoint. One, it's important for government to know what is out there from industry. But the way the government works is they come up with requirements, oftentimes years in advance. They get the funding, and we know how difficult that is to get. They get the funding, and then they deploy a solicitation out there, and it's a fairly specific scope. And often, while we may think of individuals in the government as subject matter experts, and that is very much the case, oftentimes is they don't know what they don't know. And they might not know how to put the best solution together. So it's important that you understand where your technology aligns with the objectives of the DoD through DTRA or through JPEO or even through BARDA and ASPR. So while you can go onto the websites for this challenge, I recommend you go on the websites for the JPEO and DTRA and those in HHS. You can also look back at the 2 consortial websites to just get a sense of how you might posture your solution. I've done a lot of these challenges before, or I've been involved in these challenges before, and oftentimes the entities that are winning, that are judged as successful, are showing direct applicability to a stated need. And it's not just let me tell you about your technology. That might happen, but honestly, you're going to have 5 or 9 minutes total to talk about your technology and answer some questions to intrigue the judging panel enough to place you in the top 3. So take some time in advance to write really clearly what the intended outcome is. It's not just research for the sake of research, but the incredible technology that you're developing it. How is that helping either the civilian population or the DoD population? And if you've gotten funding already from either external capital, philanthropic organizations, or even DoD or HHS, mention that in your brief, because that shows that the technology is already of interest to somebody that's a funding sponsor. So let's go down to the next slide. I had a couple more points I wanted to bring up, Laura. We talked, so again, just to reiterate, there's a total of 200,000 that's available. Those that fit in more medically focused solutions, and just to define that clearly, that is impacting the health of an individual. So vaccines, therapeutics, med tech devices would fall under medical solutions. CBRN solutions would be things that are more identifying threats, decontamination, sensors, wearables, things like that. But we can help place in the appropriate category. But 100K in the medical solutions area and 100K in the CBRN solutions area. Okay, if we go to the next slide, one more. I think there was one more I wanted to talk to. Now, yeah, review criteria. So I've hit on this very much a high level. Is it's really important to talk about these 5 criteria, both in what you upload as your submission, and just as importantly in your discussion, because the judges are going to be looking for what I hit on very hard early. What's the impact? What is the desired outcome? What problem are you solving that's of interest to a potential funder? Where does it sit at the readiness level? Just because something may be at a TRL 1, 2, or 3 shouldn't preclude you from submitting, but keep that in mind. And if you're at the lower TRL level, how long is it going to take you to get to something that's maybe prototypable? Scalability here is not talking about how you move up the TRL maturity continuum. It's talking about if I need to deploy this to 1 million warfighters, or a population, Pfizer's first 100 million doses of COVID-19 vaccine. Scalability, how quickly can it scale up? Okay, the financial viability, what do you need to make this happen? And how can it survive in the wild? Meaning, okay, now you've gotten some non-dilutive funding. Maybe you're going to get an award from one of these 2 or several government customers. And then what's next? And then your ability to articulate all 4 of those points is really your pitch quality. It's, pictures, graphs, pie charts, all of those are important. Really, really home in on what it's going to take to get your message across. Okay, you only have 5 or so minutes in the pitch to articulate what the impact and value is in those other 4 criteria. So I think I'll pause there. Laura, I'm not sure if there's anything else you want to add, or we can go directly into questions.
Yeah, I think that sounds great. Thanks for adding color and providing some information where I wasn't able to. We have gotten some questions. I always get asked if people are going to get these slides. Sure, happy to share them with you. But more importantly, the website has all of this information. So if you go there, and that's listed here, healthsecurity.techconnect.org, you'll see everything and a little bit more, including the application form, which is so important. We got another question related to number of finalists. We usually base that on a natural cutoff related to quality. It'll be 20 or fewer, I would think, typically. So let's say in the 2015 to 25 range, I would guess at the very most. But if that gives you a sense. If there's anything else operational, I'll jump to it. Um, so, Mike, can you apply to both CBRN and medical?
Yeah, I don't see why not. Now you do need to articulate why you fit in both. You don't have to tell us that you apply to the other. We would see that, but in your CBRN submission, you should address the technical areas that are more CBRN focused, more sensor, situational awareness, whatever it may be, vice something that's more therapeutic or vaccine. So where I see commonality might be in the sensing space. So a medical device or some kind of device that can give you indication that you're either about to get sick or you've been exposed or some kind of body status, etc.
Okay, great. All right, Max asked if companies that have existing DoD or OTA funding can apply.
Absolutely, and as I mentioned earlier, please make sure you include that at minimum in the pitch. That lends to interest from the federal government already in that space, and so absolutely, you're not precluded for applying because you may even have an active award. You're just going to have to talk about how this might enhance the development further.
Okay, great. I have two questions that both relate to TRL, so technology readiness level. I think it's just maybe great if you're able to speak about, is there an ideal TRL for you, or any considerations that would kind of be workarounds for that? Obviously, we're not excluding anyone specifically based on their TRL, but is there anything like a sweet spot in your opinion?
Yeah, that's a tough question. It's a good question. And the reason I say it's tough is ideally it would be great if you are in the beyond the proof of concept phase. But again, I say that heavily caveated. It just really depends on what your technology is being used for. Say, for example, you have a technology that you're already prototyping, but it may be able to be used for something you had not envisioned it for. And so you've got a working prototype, the system is working, now you're looking for a different target analyte, for example. But that shouldn't be more or less important than a technology that is incredibly transformative that's on the earlier TRL level. And so, if you're coming in with a 1 or a 2, the sell is going to be difficult, but it depends again on what that desired outcome is and how quickly you think you may get there and how important of a problem you're solving. So I hate to dance around it, but there really is no clean answer to that.
Yeah, absolutely. What it takes to deploy technologies, especially in this broad of a scope, it's wide. So
Right.
hopefully, if you have more
Right.
questions around that, we'll try to take some specific ones. I know I see a lot of those around here, but again, if you have to err on the side of assuming that you're a good fit, the application is not onerous. It is not that we're not talking about pages and pages of requested information. So go for it and assume that you're a good fit if you're not sure. Don't exclude yourself.
Right.
Another question is about eligibility. Are you open to US based researchers, institutions, companies, everything outside of the US, within the US only? What's your feeling there?
No, that's a great question. So the DoD programs that we run that are actually sponsors of these two OTs do limit eligibility to either U.S. companies, U.S. entities, or U.S.-based affiliates of foreign companies. So they actually have a physical presence here in the United States and have all the credentials to be able to do business with the U.S. federal government through their U.S.-based affiliate. I think that's probably the best path to go down, but we are not excluding anybody from these prizes, because these prizes are not funds that have come from the federal government. They are non-dilutive. You get the entirety of the money with no strings attached. So I would say we're open to all comers. But the reason I mentioned that earlier is if you join one of these consortia, particularly the DoD ones, you have to be a U.S. entity or a U.S.-based affiliate. On the HHS side, there's not that same level of delineation, but there's a preference that the funds get spent domestically. So particularly with the consortium that is looking at the entirety of the biopharmaceutical supply chain. So reshoring, onshoring, building additional domestic capability. But just that's for federal funds. These are eligible for everybody.
All right. Manuela asked, does next-gen prevention include technologies to reduce transmission of airborne diseases, such as installations of a novel type of germicidal ultraviolet light?
Well, that's a great question. I totally get the technology. Let's see. Where would that? That could fit in under integrated protection. It could fit under next gen prevention. It's not what I typically think from prevention as we describe it on the website, meaning we're really looking at more the technology of development of vaccines and that related technology. But I think it could fit there, and depending on how smart it is, it could fit under smart diagnostics as well.
Okay, great.
But interesting technology.
Yeah. Warren asked, should we focus the proposal on its application for the warfighter? For example, if our technology is dual use, should we highlight the civilian or military market strategy? Are you interested in both? How do you want them to approach that?
Yeah, great question. I would say both. But it really gets back to the heart of understanding the audience. And so while we will make sure these submissions go to our DoD counterparts, I have every intention of supplying them to our BARDA and HHS counterparts too. I think if you have dual use technology, you should highlight it. It makes the technology that much more valuable. DoD may take it and they have a very specific, unique user community, but as we saw with, say, a pandemic doesn't know whether you're wearing uniform or not. And so I would highlight both if you have any level of dual use technology.
Absolutely. Joy asked, so earlier we asked you a question about TRL, and it depends on your desired outcome. So she has to follow up on that. By desired outcome, do you mean desired outcome of how you would use the money specifically, or overall desired outcome for your technology?
Desired outcome for the technology. Now, you may be asked, what are you going to use the money for? Sort of like a Shark Tank set of questions, but definitely focus on highlighting what you see the end game of the technology. What is the technology going to accomplish?
All right, sounds good. Benjamin asked again, I've gotten a lot of questions around submitting multiple proposals, so I think we should clear this up. But specifically, let's take this question as an example. If my startup is working on two projects that fall in different focus areas, one's medical, one's CBRN, how would you recommend we apply? Should we select one? So would you I think historically, I'll just kind of quickly speak to this, because I think we've kind of answered it, but I want to make sure there's not more to add here. If you have two different solutions, you should apply two different times. Don't try to roll two things into one application. Apply twice. I guess you could win twice. There's no rule that says you couldn't. Go for it. And you could also have one that's stronger. So give yourself both, two chances is my thought there. And specifically though, you want to highlight the two different technologies. Is that right, Mike? Is that what you're thinking?
Yeah, I think if you're questioning whether to submit two because you have two distinct technologies. I would submit two. If you have one technology that could maybe do the same, I might suggest you do the same. If you try to talk about too much, there's that, I feel like there's that fine line between, hey, I'm solving A, B, C, D, and E, and then all of a sudden you run out of time to really drive home the message versus, hey, I can solve A and B, and maybe my technology also works over here. You're going to have to make that call, but keep in mind the end objective is to get selected to pitch, and in the pitch, convince the panel that you have a viable technology that solves a real problem. And if you can do that in 5 to 7 minutes or 5 to 8 minutes, whatever it is we typically allow, then let that drive your submissions. If you have so much to talk about that you don't get through half of it, that's not a good pitch quality.
Yeah. Definitely succinct and strong is better than trying to say absolutely everything, Say the most important things really powerfully and that be heard, I think. Anna asked, does already having a contract with JPEO help or hurt you?
I don't think it doesn't hurt. I think it helps from a standpoint of if that's part of the technology solution you're showcasing. Again, it indicates that there's alignment with interest from the government, which is important. And so, if you're talking about your ability to get your solution from point A to point B, and that money that's come in from the JPEO has helped you, then I would be remiss to not include that.
Yep. Validation, right? That's also
absolutely.
Further credibility and validation. Yeah. All right. Russell asked, is there a meet and greet where we can talk to potential partners and investors outside of the pitch? And I can start by saying there's not one ahead of time, except that you're speaking to one of the most important partners right here in Mike. But in terms of on-site, Mike, is there any kind of networking that happens at the member meeting or in the room or otherwise?
Yeah, that's a great point. So these will happen during our annual member meeting for these two consortia, which tend to be a day and a half, 2 days, where we have not only members of those two consortia in the audience. Oftentimes we open it up to non-members, so there's not an issue with whomever is pitching being allowed into the event, and in most cases, there's heavy involvement from the government or heavy presence from the government. That's a little bit to be determined with the posture that we're witnessing today, but we're still many months away, and I think a lot of those travel bans will be a thing of the past. But to your specific question, the entire days are meant to be networking focused. So there'll be presentations, there'll be panels, there'll be breakouts, and there'll be plenty of opportunities for, quote, formal or informal networking. And then, Rob, who's the program manager that leads these two efforts, he and I can sit down and perhaps there is an opportunity where we can cordon off a bit of time in advance of the pitches for members for those involved in the pitch contest to meet each other, or for members to come and talk to you all in advance. So great question, and let's see what we can coordinate. I think that's a great idea.
Cool. Carlos asked, in the biosensor space, is single-use diagnostics an applicable area?
Sure, absolutely.
Cool. I'm trying to take we have so many questions. I'm trying to go in as much of order to respect that people have asked these a long time ago, some of them.
Yeah, so just real quickly on the single use, I mean, something that is disposable, single use, quick use, reduces weight, makes identification quickly or more quickly. All of those are features that the government would be looking for. and there's many more, but just when you said that single use, um, if you're asking the warfighter to carry something with them, then consider their weight, the size, the form, function, etc.
Great. This is kind of a different question related to scope from Ivan, who asked, would food as medicine, a solution in food as medicine using automated modular farms be considered a health security innovation?
Yeah, food as medicine it really resonates with me. I don't know that these two government customers would be looking for that, but I wouldn't. If you're interested, I wouldn't shy away from proposing at all.
Yep.
I mean, if you think about where HHS is going, and Robert Kennedy Jr., he's very much looking at prevention, healthy eating, etc. Um, I think there's going to be more R&D dollars flow in that direction than we've seen in the past. So, yeah.
Yep. Ivan also asked, is there a cost to pitch the idea if our application is accepted?
I think the only cost is you getting to the event. The event is free to attend, and unless Rob corrects me, it's always been free to attend. So it's just the cost of you getting there. We don't subsidize your travel or hotel.
Okay. Let's see here. We only have a couple more minutes. I'm trying to get through as many as we can. Okay, this is a little bit of a specific one as well, but we are developing a plasma filtration device designed to remove a single targeted component from plasma in order to enhance the natural clotting process and improve clot strength. The technology is not directly intended for treatment or protection against biological, chemical, or environmental threats, so could it still be considered medical countermeasures?
Yeah, I think so. I have some familiarity with that technology. I'm just looking over our focus areas. Um, yeah, I think it definitely fits in the medical countermeasure space to some degree, and it's an area that if not already, we could probably align you with another one of our consortia, but I wouldn't hold off.
All right. For the review panelists on site, I think, specifically because it's a
Mhm.
member meeting. We're still developing, to answer your question, Carl. I asked a little bit about who those reviewers are. I think we're still developing that final list, and I'm not sure we're prepared to make that announcement yet. But Mike, can you give a little bit of a flavor in terms of like generally who might be represented as a reviewer, like where they might come from?
Yeah, that's a great question. First of all, we try to stay away from conflicts of interest. Obviously, we've had some success in the past in getting past government employees in this space on the panel, and occasionally we have current government individuals, but mostly we'll reach out through our network and find individuals that are either in companies that are not aligned with our consortia but have technical expertise in this space. So from a technical standpoint, a policy standpoint, maybe even from a funding standpoint, so that they're covering all bases.
Okay, great. All right, we only have 1 minute left. So the last question will be from Hugo, who asked, is IP an eligibility requirement?
Meaning you have to have patentable
I
intellectual
think that's how I'm
property.
reading it. Yeah. I can see where you could read it as either you have it or you are willing to give it up. We are not asking for anything related
Yeah,
to IP. It's no strings
so
attached, right?
definitely not giving it
But
up. We're not.
yeah.
We're just rewarding your pitch quality and idea feasibility, in hopes that it will garner interest from the federal government, in which you might get a contract and then you would have to negotiate IP, maybe general purpose use or general purpose rights from the government. They're not interested in owning your IP, but we are not either at all. You should talk about your IP that you've developed as it is, as it's relevant. But no, there's no.
Great.
IP is not important to us from a use standpoint.
Awesome. All right, everyone, that's all that we have time for today. I want to thank Mike so much for being here and sharing his wisdom and expertise and knowledge of these program. We really look forward to seeing your submission. And don't forget, the deadline is April 16th. You can apply and learn more on healthsecurity.techconnect.org. And we will look forward to seeing it and hopefully meeting you soon in Baltimore. So have a good one.
Thanks, everyone.